Hey, so sorry about the delay and the mix up with the wrong links. It's crazy, being a bit crazy today. But I'm just logging in again now. I'm just sending out the new link to everyone so they can use the new link to join. I have to send out a whole new link. Can you imagine? Right. So just giving people some time to join.
So you want great health, optimum vitality. With health being a global priority and inflation skyrocketing, time and money matter more than ever. So start working smarter, not harder. Introducing OxyFlush by My Healthcare Group. Natural health solutions that provide real results. You see, great health begins in the gut. In fact, the father of modern medicine, Hippocrates, said all disease begins in the gut. Over 70% of your immune system is also in the gut, so it's critically important to keep this area in optimal condition. OxyFlush helps quickly remove accumulated waste and associated toxins from clogging up the colon and preventing proper absorption of nutrients beneficial to your health. The impact is felt body-wide as immune cells are freed up to attend to other areas in need of attention. So, working smarter couldn't be easier. Clean your colon, lose weight and show off the healthier you. Powered by My Healthcare Group, makers of OxyFlush.
Gentlemen, welcome to an evening of profound insight into men's health. We are delighted to introduce our distinguished speaker for this special event, the eminent Aaron Warden, also known as the Juice Doctor. The Juice Doctor, a clinical nutritionist, detox specialist, and integrated wellness practitioner, is a beacon of health and wellness. Join us on Thursday, the 16th of November, 2023 at 7 p.m. on Zoom as the Juice Doctor takes us on a transformative journey towards how we can deal with diabetes. Not only is the Juice Doctor a gifted speaker, but he's also the visionary force behind multiple revolutionary brands. Through Ask Juice Doctor, he fuses cutting-edge biotechnology with natural cleansing and juice nutrition to achieve optimal health and natural healing from within. And now, introducing Effective Man by Ask Juice Doctor, a health club for men, where he will embark on a journey to guide and coach men to their ultimate well-being. But that's not all. The Juice Doctor is also the driving force behind MI Healthcare, a multifaceted health practice offering cutting-edge solutions, personalized nutritional therapy, and naturopathy using the functional medicine approach. And last but not least, Vivo Nutrients, where the Juice Doctor promotes freedom through well-being, equipping people with the knowledge, tools, and lifestyle changes required to take charge of their health. On the 16th of November, we invite you to be part of a transformative experience with the Juice Doctor as we participate in the Diabetes Awareness Month. Gentlemen, get ready for an evening of enlightenment and empowerment with Aaron Warden, the Juice Doctor. Join us on Thursday, the 16th of November, 2023 at 7 p.m. on Zoom.
Okay, good evening. Thank you for joining us for our live talk on prostate health. I know the advert said diabetes, but we're talking about prostate health. Today, got a bit of a technical hitch with the link, the last link. So if you tried to join with the last link, I humbly apologize that there was a little bit of a technical itch that just disabled that link. So we're now no longer able to use that. So I'm just giving people a little bit of time to log in. Thank you for those that have logged in already. Hoskin, thank you for joining. If you have joined and you have got the new link, just give me a quick hi in the message in the chat. So I know I'm not speaking to myself because I actually can't see who is in the house unless you make yourself known via the chat. So if you are with us, please just send us a quick message in the chat to say hi, good evening, or I'm on or I'm in, just so we can know who is in the building with us today. I know we're going to have quite a lot of feedback after, because we're going to have a live recording. We're going to record this and make sure that it goes out to a lot of men. So we really want to get as many men listening to possible, because the information we're going to share today is going to really empower you with a lot of understanding about what is happening with your prostate. A lot of people don't get to know what's happening with their prostate oftentimes until it's too late. So we really want to take this opportunity to really give you we'll take a deep dive into the workings and the mechanics of your prostate, how it gets into the state it does that will leave you vulnerable to, this prostate diseases, obviously ultimately prostate cancer, and, even death. But these things are all preventable once you have the right information and the right approach. So that's what we're going to really cover today, just really breaking down some of those myths. Oh, thank you so much, Jamie. You logged in. Excellent. We're going to really look at breaking down some of those myths and some of the misinformation and things that people aren't really aware of around their prostate. So if you haven't forwarded the message on, please forward this new link on, because a lot of people didn't get the link, the new link, because the old link has expired because there was a bit of a technical problem. So we're not using that link anymore. So if you've got the new link, please use this opportunity to share it with other men, your dad, your sons, your uncles, your cousins, your nephews, all the men in your network, in your phone book. If you've got access to groups on WhatsApp or Telegram or Facebook, please share the new link on your Telegram, on your WhatsApp, on your Facebook, so we can really reach out to as many men as we can, because a lot of men are suffering. And I've had quite a few calls, phone calls and messages from men who are really in a bad state, and then they haven't really got much places to turn to, because people are just saying, well, there's nothing we can do. Come back in 6 months, come back in 3 months. Maybe by the time they go back, it's too late. So if they have access to the information, the kind of information we're going to share today, it could be life changing, but most definitely it could be life saving. So please share the message, share the link that you've got with the details of how they can log in. A lot of people were looking forward to logging in today, and we were going to be live on YouTube, but the powers that be don't want this information to get out there. So we had to just, regroup, reconfigure, and come again to make sure that we're going to get it out there. So I'm going to give just about another minute or so, just to make sure those that wanted to share it out with other people will do so, and then we'll jump right.
So you want great health, optimum vitality. With health being a global priority and inflation skyrocketing, time and money matter more than ever. So start working smarter, not harder. Introducing OxyFlush by My Healthcare Group. Natural health solutions that provide real results. You see, great health begins in the gut. In fact, the father of modern medicine, Hippocrates, said all disease begins in the gut. Over 70% of your immune system is also in the gut, so it's critically important to keep this area in optimal condition. OxyFlush helps quickly remove accumulated waste and associated toxins from clogging up the colon and preventing proper absorption of nutrients beneficial to your health. The impact is felt body-wide as immune cells are freed up to attend to other areas in need of attention. So, working smarter couldn't be easier. Clean your colon, lose weight and show off the healthier you. Powered by My Healthcare Group, makers of OxyFlush.
Okay, thank you. Welcome once again. Welcome to Jamal. He said, is it me or is there no audio? Can everybody hear me loud and clear? If you can hear me loud and clear, just give me a quick number 2 in the chat, please. If you can hear me loud and clear, just saw a message saying, is there no audio? I'm hoping you can hear me loud and clear, because I really want to get started and jump into some really powerful information today. So welcome, Jamal. Grand evening, Colin. Welcome to McLean. Welcome, Hoskin. Welcome, Kenrick. Thank you so much for the feedback. Thank you, Washington. Thank you, Jamal, as well. Thank you, George. Welcome, George. Welcome, Clifford. This is fantastic. I'm really, really excited. I'm really, really, really happy that so many people have been able to log in. People are trying to get in in Oxford. I can see people trying to message me from Oxford. They're trying to get in. I'm just going to quickly send him the new link as well. Yeah. Okay. So welcome to today's live Q&A with the Juice Doctor. We are going to be talking about prostate health and demystifying some of the misinformation around prostate health and how men can improve their health and what their options are available, what the options available to them are if they find themselves running into problems. So I'm going to jump right in with my presentation. I'm going to cover some quite deep and powerful information. I'm going to share a few nuggets. I'm going to get through quite a lot today. So if you've got a pen and paper, you may want to grab it now to make sure that you can participate and take some notes. Okay, so I'm the Juice Doctor, aka Aaron Warden, natural health practitioner, clinical nutritionist, and founder and senior practitioner at My Healthcare. We specialize in finding natural health solutions to common problems. We use a lot of cutting edge technology to identify imbalances, disorders, and deficiencies in the body. And then we use nature, food, plant-based products, and diet and lifestyle to bring about order from within. So we're talking today about prostate health and how you can use food, your diet, and your knowledge to improve your prostate health and prevent it from degenerating into serious conditions like prostate cancer. I know there are a few people on the line who are or who have been diagnosed with prostate cancer, so I hope this information is going to be very useful and beneficial to you. So I'm going to bring myself out so you can have full access to the screen so we can really get maximum impact on the information we're going to share today. Actually, I can do myself in the corner. There we go. Right, so we'll start with the main things that we're going to be covering today. We're going to be talking about what BPH, or benign prostatic hyperplasia, is. A lot of people are suffering with that, but they'll probably hear their doctors talking about it, but they're not always familiar with what the terms actually mean. We're also going to be covering what is the PSA, or your prostate-specific antigen. A lot of people may hear that term or come across that term again, but not quite sure what it is or what it represents. We're going to look at prostatitis, what having an inflamed prostate looks like and what the causes are and what the treatment options are and how you can prevent it from developing further into prostate cancer. And we're also going to look at prostate cancer and how we can prevent ourselves from getting into that situation. If we are already there, some treatment options that you can employ that will help to alleviate some of your stress. Okay, so what are the risk factors for prostate problems? The first thing is we're looking at is prostate benign hyperplasia. The risk factors start with your age. Your risk for developing benign prostate hyperplasia increases with your age. The older you get, the more at risk you are, especially men that are over 50. I know a lot of the people on this line are over 50. I know people like Kenrick, they're on the younger side, which I'm really glad to have you on, because you are one of those people that can take this information and share it amongst your friends, your 30-year-olds, your early 40s, and really help to empower them with the knowledge that and tools that they may need to prevent themselves from falling into any of the demises that we're going to discuss today. Another risk factor is that you may have a family history of BPH, or benign prostate hyperplasia, which just means your prostate becomes enlarged. If you're obese, if you're overweight, that's also going to put you at risk of developing BPH. If you're diabetic, if you already have diabetes, these are precursors for leading you into having a benign prostate hyperplasia or an enlarged prostate. If you suffer with high blood pressure, having high blood pressure, especially when it's not controlled, again, could place a huge burden on your hormones and underproduction of testosterone, again, which could be a contributing factor to your enlarged prostate. And of course, if you smoke, if you're a smoker, that's going to put you at a much higher risk of developing prostate hyperplasia and indeed prostate cancer, as well as a lot of other cancers, because the amount of chemicals and toxins that are brought into the body through the nicotine. So, what are the most common symptoms of benign prostatic hyperplasia, or let's just call it an enlarged prostate? You may find yourself having frequent urination, especially at night. If you find yourself having a lot of, find you going to the toilet a lot, these could be early signs of you having an enlarged prostate. If your urine or your urinary flow is weak, or it's a slow urinary flow, it's not, you can't really wee up a wall where you have that kind of pressure that you used to have when you're younger. These are signs that things may be breaking down, or you may have some additional pressure from the prostate that's enlarged, pressing down on the bladder. If you have difficulty starting or stopping urination, or feeling like you haven't emptied out completely, incomplete urination, these are all signs of having maybe developing a large or enlarged prostate. Dribbling after urination. So if you're not, you've gone to the toilet, you've finished, but you're still dribbling, you've shaken off, but you've still got elements coming out. These are all signs that there's something not quite right with your prostate, and a good sign that you can take action very early to have the right intervention. Having a urinary tract infection. A key sign of having a UTI would be that you'd have a burning sensation when you wee. If your wee is burning, or you constantly have that where your wee is burning on a regular basis, or burns in the morning, or you have a slight burning or slight tingling, these are signs that you may well have a UTI, which is a urinary tract infection, which we'll talk a little bit more later on about how infection impacts your prostate and the health of your prostate and how it can lead to further problems if not addressed earlier on. And then finally, if you have blood in your urine. Now, looking at the image here, you can see on the left side, you can see what a normal prostate looks like, which is just below the bladder. And then on the right, you can see where that prostate is enlarged, which is what we classify as a benign prostate hyperplasia, where your prostate is enlarged and it's also putting some pressure on the bladder. And this will cause that restriction to your flow of urine when that walnut-shaped organ starts to become larger than its casing or the environment that's surrounding it. Now, how do they normally diagnose that you have BPH? The normal way that they use, which is not a very nice way, is where they have a digital rectal or exam to check the size and feel of your prostate, where they actually sometimes they'll prod around using, either a finger or a device to really get to see, the size and feel the size, which is not a nice feeling or sensation for men, because obviously men don't want to have that kind of, derogatory experience as a man, whether young man or old man, going through your life. So it's not the best way to check. So if you can prevent yourself getting into a situation where you have to do that, then that's going to be the best place that you can be. So we're going to help you to achieve that by the end of today's presentation. Also, urinalysis. If they check for blood or infection in your urine. That's another way they can diagnose if you have an enlarged prostate. They can look for your PSA, which is your prostate-specific antigens, to measure the levels of PSA in your blood. They can also look at your urinary flow. They call it uroflowmetry, which is a measure of the strength and the flow of your urine. Lastly, they can use a cytoscopy, which is a direct look at the urinary bladder itself to see what the impact of your prostate is on your bladder. Now, if you don't want to go through that process of having that invasive process that most of them are making available to most men, we have a very good non-invasive prostate health scan. In fact, we have a specialist scan that's dedicated purely to men's reproductive health, which includes their prostate. We look at all aspects of your prostate. We look at all aspects of your kidney, your bladder, your urethra. We look at things like your testicle function. You look at your erection function. If you're having problems with your erections or your libido is low, these are the kind of things that will flag up, and we'll look at what if imbalances may have developed in the body or in the blood that have gone undetected, that are manifesting in you experiencing these symptoms, and especially when you have them for quite a long period of time. So we do that scan, and it's done through your hand, where you use the hand, and we use the signals and information, what we call GSK, galvanic skin response, GSR, where we look through, we read your hand, and the technology basically is able to read the responses from your body when the relevant digital biomarkers are presented as questions. So your body actually speaks for the software and gives us a very detailed and accurate report of the state of your prostate. If you can see the picture here in the prostate analysis card, this is from a real person. I just blanked out the name. It was done on the 15th of November. You can see the prostate hyperplasia at the top. So they've got an enlarged prostate. So their prostate is quite enlarged. That's why it's in yellow, because green would be the normal, blue is a little bit enlarged, yellow is very enlarged, red is extremely enlarged, where they're going into the really danger zones. Also in the middle, you can see the level of prostatic calcification, where these are all things that will contribute to the levels of enlargement that they may have. If you have a lot of calcification in that area, it starts to become hardened. And then we look at prostatitis, which is the one at the bottom, where we're looking at inflammation, how the prostate has become inflamed. Now, this is a classic profile of someone who could be moving on their way to cancer if this situation is not resolved, and if the infection in particular is not brought under control. So you don't want to be having an enlarged prostate and you don't know about it, and having an inflamed prostate as well, because this is where you leave yourself at risk and vulnerable of developing further complications. So what are the treatment options for having an enlarged prostate? Well, when you start to look at how you can bring your enlargement down, there are a few things that you can do, a few options that are available to you. We'll talk about some of the conventional ones first, and we'll talk about some of the more holistic ones a little bit later. But firstly, maintaining a healthy weight, having regular exercise, and not smoking, keeping your alcohol consumption to a minimum is a great way. Medications, they're normally prescribed things like alpha blockers to relax the muscles in the prostate and the urethra, which makes it a lot easier to urinate. So it kind of gives you that ease and relief in the first instance. Then lastly, they can look at surgery. which is where they're talking about going in and actually removing the gland, which is not really a good option if it can be avoided. They also use alpha reductase inhibitors, which helps to shrink the prostate gland, or a combination of these therapies to try and bring about the desired result. Now, if you're going to go for surgery for some people, it's the only option because they've allowed it to be, remain enlarged for so long, and the impact it's having on their quality of life is quite detrimental. So they may not be able to go to the toilet, or when they do go to urinate, it's very painful, or they've got a lot of discomfort that's pretty much bothering them day and night. So they will look at some surgery options, and the most common ones that we see are listed here. So we've got the procedure, which is what we call a TURP, which is a transurethral resection of the prostate. So they actually reposition your prostate by cutting away a section of the prostate, and they remove excess prostate tissue using an electrical wire loop. So for this type of operation, they would put you under general anesthetic. You probably have to stay in hospital for 1 or 2 days, but then your recovery time once you discharge could be anything from 4 to 6 weeks. Another surgery option may be having a TUIP, which is a TUIP, which is what they call a transurethral incision of the prostate, where they have a procedure to treat urinary symptoms caused by your enlarged prostate, where they'll make a small incision into the prostate gland itself to actually widen the urethra to allow it to accommodate the enlarged prostate and reduce the damage and the restriction that it's causing. This one you generally they'll use like a lumbar puncture type thing where they put some fluid into your lung to give you like a local anesthetic. You wouldn't have to stay in hospital. It's almost in and out on the same day, and recovery for that would generally be between anything from 2 to 4 weeks. They also have another option, which will be laser surgery, where they use a laser to destroy any excess prostate tissue using a high energy laser. This one will be done under general anesthetic, or they can do it under local anesthetic. Again, this could be in and out keyhole surgery on the same day, where you don't have to stay, you don't have to be admitted, and you'll be probably take about 2 to 4 weeks to recover. Another one that they don't really make it accessible to a lot of people, but a lot of people aren't aware of this, is what they call a WVT, which is a water vapor treatment, where they use water to destroy the excess prostate tissue using a really high-powered water vapor that really goes and just flushes away that tissue. It's very, very effective. Actually, they've got quite a high success rate in the region of about 90% of the cases. They produce really good results, and there's very, very, very few adverse events once they've employed that procedure. Again, that's been done under a local anesthetic. You don't need to stay in the hospital. You don't need to be admitted, and the recovery time is quite short. Generally 1 to 2 weeks, and you're back up and running. So they've got quite a few options that are available, but they're not always made widely known unless you actually ask your physician. So these are things that would be good for you to make note of. So when if you are in that situation and you're looking to have some kind of procedure, that you could inquire with your GP or your hospital specialist or your urologist to see if this is something that be available to you. And the last one is the PUL, which is what they call a urolift, where they put implants into your prostate gland and lift it to hold the enlarged tissue away to take the pressure off the bladder, so you can still have use of your bladder without it being impeded by the enlarged prostate. That again is done under local anesthetic, again, in and out on the same day, and 1 to 2 weeks to recover from that particular procedure. So that's giving you 4 or 5 surgery options for those that are in the advanced stages of having enlarged prostate, and looking at some options that they may or may not have discussed with you during your treatment. So now we're having a quick look at what a normal prostate would look like compared to what an inflamed prostate, because now we're going to go into a little bit more about prostatitis. So if you look at the image on your screen, you'll see on the left, you've got a normal prostate, where you can see the urine coming down quite a wide pathway. There's no real restriction. It's quite easy, free-flowing. You can see the urethra, which is part of the bladder. So you've got the kidney, bladder, and the urethra. They all work together. And at the bottom there, you've got the prostate. But on the right-hand side, where you've got the prostatitis, where you've got the case of an inflamed prostate, this is where you can see that pathway, that urethra, is actually quite narrowed because the prostate is enlarged. So it's squeezing the urethra on both sides. So that urethra has now become compressed, which is now going to impede your flow of urine from your bladder to exit the body. And this is when you start to develop these problems, because now just not having enough urine be able to flow, which means bacteria is not always going to be allowed to leave and travel out safely. So when you start to have that bacteria starting to back up and build up, this is when you can start to lead to further types of infection. So if you've already got an enlarged prostate, that's the first, red flag. That's the first bad sign that your prostate's enlarged. But when it also becomes inflamed, then you're running into a more sort of grey and dangerous area that you really need to be looking at, getting the right interventions in early on, so that you can take the relevant action to reduce the inflammation and look at the source. But more importantly, it's good to understand what the source is, which we'll discuss in the next couple of slides. Before we do that, let's look at some of the symptoms, because you may be experiencing this but not realizing that the underlying factor is the fact that your prostate is enlarged or indeed inflamed. So let's look at some inflammation symptoms of having an inflamed prostate. So the first thing you'd notice that you have some pain or discomfort in the pelvic area, or your groin, or around your genitals. If you notice you have any pain in that area, these are early signs that there may be some issues with your prostate. It's quite highly likely that it is coming from the prostate. So just check yourself and do a quick assessment to see if that's something that you've experienced over the last few weeks or months or even years. If you find yourself having frequent urination, another key sign, or burning urination or burning when you wee, that's a sign of the urinary tract infection, where you've got some bacteria building up that's not been flushed out, or when it's on the way out, not all of it's come out, so some of it's been caught up in the pathway on the way down, so that then starts to multiply, and that will then start to cause some discomfort, some stinging or some burning. You may also have some painful ejaculation. It's another sign that you've got some problem with your prostate, where the bacteria is now starting to enter into your sperm. And again, when you're starting to come out of that pathway, it's now starting to trigger signs of inflammation, which again will leave you in a state of discomfort. And then also, if you have blood in your semen, if you notice any blood in your semen, these are other signs that there's problems with the prostate, and a clear sign that you want to get some attention, whether it be medical attention, holistic attention, whatever attention you're going to give it. It's time to take action before it develops into something worse. So let's look at some causes of chronic prostatitis. Anytime you see anything itis, just so you know, when you take any word that mentions itis at the end of it, itis basically means inflammation. So you have sinusitis, it means inflammation of the sinus. You have prostatitis, inflammation of the prostate. So anytime you see the word itis with any other word, that means it's to do with inflammation. When you see chronic, it comes from the Greek word chronos, which means time. So if you have anything that's chronic, it means you've had this situation for a long time. So that's the difference between having, say, acute, which maybe just come on recently. Maybe you had it for a short period of time, maybe a matter of days or hours or a couple of weeks. That's what we describe as acute. But when that starts to remain in that state, and it's not, changing, or it's not reducing, you're not getting any kind of long-term relief, maybe it's progressively getting worse. Over time, that will then be described as a chronic condition. And if it's inflammation, then if it's inflammation of the prostate, it'd be called chronic prostatitis. So let's look at some of the causes of this type of situation. To be prepared, they say it's largely unknown what causes the inflammation, but some suggested hypotheses are that it may be due to an infection, which was actually quite interesting to discover, because once we realize that it's an infection, then we can from our scan, we would identify what bacteria are relatively high in your body, or in your blood, or in your gut, or wherever they are in the body. Then we can then target those particular bacteria and bring down those levels, which will then have a very positive impact on your level of infection, and again, the levels of inflammation that those bacteria have caused. Because when you have bacteria that continue to multiply, they release a toxin. And when they release their toxin, that toxin is what triggers the inflammation. So it's not directly the bacteria, but sometimes it's the byproduct of those bacteria as they go through that respiration process and as they reproduce as well. So they produce that toxin that causes the inflammation. Also, it may be caused by autoimmune conditions. So if you've got problems with your gut or leaky gut, and you've got your stomach lining is damaged and foods are escaping out of your stomach, getting into your bloodstream, it will trigger your immune system to overreact and start to attack healthy tissue. So autoimmune conditions also have a contributing factor to chronic prostatitis. And chemical irritants. If you take a lot of chemicals, or if in your work, or use a lot of bleach in your house and you don't put a mask on, or you haven't got the place well ventilated, windows open, etc., and you're using very strong bleach or strong chemical-based cleaning fluids or cleaning materials, these can also trigger irritation and be linked to inflammation developing in your reproductive zones. And then lastly, nerve damage, to the pelvic area. Could be anything through, overexerting yourself in the toilet, when you maybe suffering with constipation, or you're pushing too hard or lifting things too heavily. Any amount of damage caused to the pelvic area that's going to affect the nerves could also cut off the flow of blood and the flow of nutrients to your reproductive organs, which again could lead to that part becoming inflamed. So going a bit more deeper into some of the causes of the inflamed prostate, some of the main prostatitis causes are known as, the first one which is known as acute bacterial prostatitis, or ABP, which is a bacterial infection of the prostate that causes a sudden or severe symptoms to develop. It's quite rare, but serious conditions that require prompt medical attention do come up quite often when the bacteria has multiplied quite rapidly, and especially if you have a diet that's very rich in sugar, or you have a lot of sugars in your diet, or sugary drinks or sugary foods. Again, we've talked about if you're diabetic, you're a higher risk. So if you have a lot of sugary type foods or sweets or cakes, biscuits, etc., these all help to compound that situation, because bacteria feed on sugar like nobody's business. If you've got bacteria and the bacteria are dying and you want to revive them and bring back to life, give them a bit of sugar and you'll be amazed how quickly they revive and come back and start to multiply. Another cause would be what they call CBP, or chronic bacterial prostatitis, which is a recurring bacterial infection of the prostate that causes less severe symptoms than the ABP, but it's more common than ABP and can still be difficult to treat, because the bacteria will come, they'll multiply, they'll develop what you call an infection. You may treat it, or your immune system may get on top of it, because all this could be happening unbeknown to you. Your immune system may get on top of it, but then whatever you were doing, or whatever food you were ingesting, or whatever lifestyle or habit or pattern you were following, could then reinfect yourself or re-trigger that process that starts you to become reinfected once again, leading to that bacteria coming back and the prostate continuing to enlarge. And all this puts a huge burden on your immune system, because while your immune system is trying to deal with these infections that keep recurring, it's going to take away resources that there will be much needed to affect a lot of repair. So while you've got an enlarged, or BPH, benign prostate hyperplasia, where your prostate is enlarged on one front, that's stretching the immune system. Then you've also got the infection with the bacteria on another front, which is also stretching the immune system. This is a perfect environment in which cancer can now start to develop in that perfect storm, so to speak. And then you've got the asymptomatic inflammatory prostatitis, which is like IP, which is characterized by bacteria inflaming the prostate gland, but it hasn't got any symptoms. And this is one of the classic symptoms or classic signs or causes of prostatitis, where you don't necessarily feel the symptoms, but you may discover it later when you maybe go for a check or a general check for your reproductives, or you visit your urologist, or you have a problem with your kidney and they may happen to do a check and they identify that your prostate is involved or also enlarged. So what are the treatment options available for prostatitis? Again, if it's ABP, they normally use antibiotics. Antibiotic and the length of the treatment will depend on the type of bacteria that is causing the infection. And this is where we really want to start, doing a lot more research, because we're really excited when we actually discover underlying factors, because we specialize in identifying the underlying causes behind different demises, different situations, different conditions, different illnesses. We specialize in getting to the root of the matter using our technology, which really identifies any, overproduction of any particular pathogens, bacteria, fungus, parasites, chemicals, heavy metals. That's what the scan will really help us to identify. So when we look at the bacteria, we can then pinpoint the particular bacteria. If we see it on a regular basis, where people that have an enlarged prostate would also look to see if there are any matching bacteria that correspond with that type of infection. And then we can pinpoint and target that particular bacteria and bring that situation under control. So acute bacterial prostatitis is one that they use antibiotics for. We don't really, advocate antibiotics, because we know the damage that it causes to the microbiome. How it puts the whole of your microbiome out of balance. I mean, one dose of antibiotics can wreck your microbiome for life. Yeah, it can wreck it for life. Just one dose, one course of antibiotics. I know there are people that have had several courses, over the course of or several doses of antibiotics over the course of their life. So having 3, 4, or 5 courses of antibiotics for different infections is going to have a significant impact on the health of your gut and your gut flora. So you may well be experiencing other issues such as bloating, digestion problems, inability to digest your food, constipation. These are all sometimes a result of the lack of bacteria, or good bacteria in particular, that have been destroyed by the antibiotic course that you had, and the bacteria, the bad bacteria that started to move in once they know that your defenses were down. Another treatment is CBP, which is chronic bacterial prostatitis, which is also treated with antibiotics. However, the treatment may need to be continued for several months or even years. And this is what I'm talking about, those cases where you have those long-term dosing of antibiotics, which is going to really have a significant knock-on effect, damaging knock-on effect to your health on so many other fronts, because your good bacteria is literally being wiped out, leaving you very vulnerable and susceptible to opportunistic infection, because your defenses have been, quite heavily damaged and hemorrhaged. So then the last one is you're looking at how chronic prostatitis and chronic pelvic pain syndrome, which I call CP or CPPS, is treated. They use a different variety of medications, including alpha blockers, anticholinergics, pain relievers in some cases, or they may use alternative therapies such as acupuncture or massage, which is sometimes useful to help to bring down the inflammation where they're trying to employ alternative methods. So these are some of the treatments that they are available for people that are going to go the conventional route. We'll look at some of the more holistic ones as we progress through tonight's presentation. So let's talk about some self-care. How can you prevent yourself from getting into that situation where your prostate has become inflamed? Well, the first thing is having good hygiene. Washing your hands regularly, avoiding sexual intercourse with someone who has a urinary tract infection, or somebody suffering with BV or bacterial vaginosis, or they've got high levels of thrush or high levels of yeast. You want to try and refrain from people that are in that situation. And sometimes they will tell you, or you can ask them, or you'll feel it. You've had intercourse and you get a bit of a burning sensation. That's a sign that there's an overproduction of bacteria, so they may be having some form of BV or some level of thrush. So you want to try and reduce or refrain from having any kind of relations with that person until they've got that situation under control, because you're going to be exposing yourself directly to those bacteria. And if your bacteria levels are already quite vulnerable, then you're going to put yourself at additional risk. Of course, drinking plenty of fluids. Make sure you have a high intake of water. Will help to flush out the bacteria from your urinary tract, because oftentimes people develop UTIs because the body's trying to flush the impurities out of the blood through the kidneys, and they'll use the bladder to eliminate those toxins from the body. But if you haven't got enough water to facilitate that process, half of it may come out, half of it may get stuck in the urinary tract, which will then start to cause those bacteria to start building up and multiplying in that very tight, small area, which will then lead you to developing a urinary tract infection. You start to get burning when you wee. So drinking plenty of water really helps to alleviate that situation, or prevent it, more importantly, from developing in the first place. Avoid irritants, things that will irritate and cause inflammation, things like caffeine, alcohol, spicy foods. If you know you're a person that eats a lot of spicy foods and you're already having a problem with your prostate, then you may be eating these foods unbeknown to you, not recognizing that they're having a negative effect on your already inflamed or enlarged prostate. So reducing your intake of spicy foods, reducing your intake of coffee, alcohol if you're a drinker, cut down on the rum, cut down, instead of doing it once a week, maybe do it once a month, or, once every 2 weeks, instead of having it, on a regular basis, those of you that drink on a regular basis. So there's quite a few things that you can do that can, help you to change your situation just by having the right information that you can then act upon to improve your prostate health. Of course, emptying your bladder completely. This will also help to prevent bacteria from building up in the bladder, or you can use a warm compress or relaxation exercises. And of course, getting yourself regularly checked out. Regular checkups always help to really bring that sort of situation under control. So that's just a few of the self-care tips that you can use to reduce your chance of your prostate becoming inflamed. Let's look at some understanding. Well, let's kind of jump into a little bit more of what the PSA is and what it does. Because when people talk about prostate cancer, they always talk about the PSA levels, and you hear a lot of people talking about, my PSA levels high, because they've heard that term for the first time, often when they've gone to the GP or they've gone to the hospital. So we're going to kind of have a little bit of a deep dive into what is the PSA and what is the impact it has on people that they have or develop prostate cancer. So what's the PSA? Your PSA stands for prostate-specific antigen. It's a protein produced by the prostate gland, a walnut-sized gland located just below the bladder in men. And PSA actually helps liquefy semen, so it actually has got a good function and purpose in the body, because it helps to liquefy the semen, that fluid that contains sperm. So small amounts of PSA normally will enter the bloodstream, and the levels can be measured in a blood test called a PSA test. So they're looking for the levels or the amount of PSA in your blood. It can be normal in prostate diseases, including cancer. So if you've got cancer, they say you've got high levels of PSA. It doesn't automatically mean you have cancer, because it depends on certain cells of the prostate producing the protein and what state those cells are in, while at the state that test was actually undertaken. So I've got a diagram here that really helps you to kind of get a bit of a better understanding or deeper understanding of what the PSA is and how it actually impacts your well-being. So looking at the prostate gland on the left, you've got the image on the left where the prostate gland releases the prostate-specific antigen molecules into the blood, and then it gets processed by the kidneys and the bladder. You can see the bladder and the kidneys all working together. That's why you've got the kidney, the bladder, and the urethra. They're all part of the same system, or part of your urinary system. So when you're going for prostate treatments, you always go and see a urologist, because that's the area that they will specialize in, looking at the function and the flow of those organs working in tandem together or in synergy. So when you have a PSA test, it will actually measure the amount of PSA that's been released, the amount of PSA molecules that have been released into the blood. So if your levels are, they have a range. If your levels are in the green, so to speak, then they'll consider that you're in range. If your levels are going over to the red, that means it's a sign that there's a cause for concern, let's say. It is normal for all men to have some level of PSA in their blood, as I said, because the nature of how the kidney works and how the prostate works. It's always going to be secreting certain levels of the antigen into the blood for different reasons. A raised PSA level doesn't necessarily mean it's something bad. It can be a sign of cancer or of prostate cancer, but it can also be raised for a number of other different reasons, including, as we mentioned earlier, you could have a urinary tract infection, a UTI. It could be that your bladder has not been able to empty itself properly, so therefore your bacteria are starting to build up, which will again trigger the release of that PSA, or the levels of the PSA having to rise. So if you had prostate stimulation, if you're a person that you engage in anal sex, these again are key precursors to increasing your levels of PSA in the blood. Also, if you're a person that rides bicycles, if you have, some people go to what they call spin classes. If you go to spin classes and you spend a lot of time on those bikes, you might spend 45 minutes, sometimes 50 minutes in a session. It's quite rigorous. It's quite aggressive, exercise. Yes, it's very, good for your cardio, but it can also be quite damaging to your prostate, because you're putting a lot of pressure on that very sensitive area. So there are actually certain leggings that you can wear, that you can buy from, even places like Sports Direct, or is it Sports Direct? Yeah, Sports Direct. You can get specific leathers that have like a little box, kind of like a jock strap protective part in the crotch area, that actually provides a little bit more padding and protects you from the damage or the friction that may be caused, while you're riding the bike or any other type of vehicle. Other prostate problems, such as enlarged prostate, can also contribute to you having your PSA levels high. So there's lots of different factors that can contribute to your PSA levels being high. So you want to be as aware as you can of all the different reasons why. So when somebody tells you, oh, your PSA is high, you don't automatically just say, oh, I've got cancer. No, it doesn't necessarily, they don't necessarily follow. So the more you know is the more you're able to make the right decisions. So now looking at the next stage, once you've allowed your enlarged prostate to stay enlarged for a long period of time or extended period of time, and you've also developed a level of inflammation which has not been brought down or not been reduced, now you're leaving yourself very wide open to developing prostate cancer. Because you look at the picture on the left now, you can see the enlarged prostate, and it's continued to be enlarged, and you've got some tumors starting to grow. And these are malignant, they're no longer benign. These are now malignant tumors, and they're developing again because you've got that perfect storm, that perfect environment where you've got the prostate that's enlarged, You've got the bacteria that's been continually being recurring and continually causing infection and rapidly multiplying. If you've had a lot of antibiotics, you've not taken any probiotics, you've not done anything to try and balance out the imbalance that's been caused as a result of that continuing cycle, you've now contributed to a perfect inroad for cancer to start developing. So you see the tumors are starting to develop on the prostate, and that's when you start to looking at having other treatment options, which we'll come into in a short while. But some of the causes of prostate cancer are, again, they say they're largely unknown, but the risk factors include things like your age. So once you know you start going over the age of 50, sometimes it's even gone down now to 45 because of people's diet and lifestyle. Your age is the most common factor that, men over 50 are much more prone to developing prostate cancer. Another risk factor, again, is your race and your ethnicity. Prostate cancer is more common in black men than in white men. Hispanic men are also at an increased risk. So your background, also your family history, having a father or a brother who has had prostate cancer increases your risk of developing the disease, partly because of your lifestyle. Because if you follow the same sort of lifestyle and you eat the same sort of foods, then it's highly likely that you're going to develop the same sort of problems. So it's good to look at all aspects of your siblings and your lifestyle that they lead in comparison to the life that you lead. So you have the opportunity to change or break that cycle by, getting yourself informed, arming yourself with the knowledge, and of course, implementing that knowledge and taking action. Genes as well can also play a part, because certain genes such as the BRCA1 and the BRCA2 can increase your risks of developing prostate cancer, which is something that's beyond your control. But again, genes through epigenetics can actually be influenced, because if you have the right understanding, you know that you can influence genes or the expression of those genes via the environment that those genes are placed in. So you've got the environment internally, and you also got the environment externally. So different environments can impact the expression of different genes depending how they're exposed. Also, your diet. Your diet is a big key part of your risk for developing prostate cancer. If you have a diet that's high in red meat, if you eat lots of processed foods, you have a lot of full fat milk, foods that contain high levels of protein, hormones, and things that have already been quite modulated or engineered or modified, these are going to put you at a very, very high risk of developing prostate cancer, because you're going to have a lot more additional pathogens and toxins coming into your body that are going to put a huge burden on an already quite well burdened immune system, and it almost puts you into a straitjacket where it could be like the smallest thing could have the biggest impact, because your immune system is so stretched, dealing with so many different things on different fronts. So your diet is key, and make sure you're aware of the type of foods you want to avoid, and also having the knowledge of the type of foods you want to include or increase. Obesity, if you're overweight, it also increases your risk of developing prostate cancer. And of course, exposure to environmental toxins, as we said about the cleaning fluids, the cleaning materials, different agents that are in your food, lots of pesticides. If you have a lot of bread, you have a lot of rice, you have a lot of pasta, you have a lot of wheat type products. These are always laced in different types of pesticides, which they really have a negative effect on your reproductive health. We have a lot of women that are struggling with fibroids and endometriosis and polycystic ovaries because of their high intake of these type of foods. They not only damage the balance of their hormones, they're also damaging their reproductive organs and their tissues that are involved in that process. And the reason this happens is because when they use those pesticides on the crops, the objective is to prevent the bugs from reproducing and coming back to infect the harvest the following season. So they'll spray them with these chemicals and pesticides that will interfere with their endocrine system, which is all their hormonal system, so that even if they obviously it'll kill them off, but it'll make sure that their ability to reproduce has been greatly damaged, or if not completely wiped out. So when you take those foods that have been sprayed with those type of pesticides and you ingest them as part of your diet, you're now taking these organisms, you're now taking these chemicals, you're now taking these toxins into your body. And very soon you'll find that you start to develop those same type of problems with your reproductive system. Your hormones start to go out of balance. You start producing the wrong type of hormone, or not enough of the right type of hormone. Your testosterone levels start to drop, your estrogen levels start to increase, and lots of things start to go into a state of imbalance, which then starts to lead to disorder, which will then start to end up as disease. and you start to see your different symptoms. So the food, again, has a very big part to play in that process. So now we can look at an MRI scan. We can see a tumor developing inside the prostate. It's one of a patient that was referred to us. This is the tumor developing quietly. Again, they had the perfect storm, as we said. They had the enlarged prostate, they had the inflamed prostate, they had the really bad diet, they low water, they're not really drinking a lot of hydration. They had just all the things that will perfectly put them in position to develop cancer. And of course, cancer was starting to develop, and they were obviously running around trying to seek alternative methods to bring it under control. Luckily, they're fine now, but it was quite a harrowing experience for them, and a big wake up call for them to realize that actually their diet and their lifestyle had a lot to do with their situation. It wasn't just like random, or like, why me? It's like, why not you? If you live in that sort of lifestyle, and you're just not just making all the same mistakes. So now looking at some of the stages of prostate cancer when it develops, it will start with stage 1, where you've gone through the enlarged prostate for a long time. You've gone through the inflammation. You've then got the tumor starting to grow. So you can see stage 1 on the left. And as that situation remains, and you're not having any kind of intervention, you're not making any changes to your diet, to your lifestyle, to your knowledge, and arming yourself with more knowledge or information so you can make the right decisions, you'll see the tumor start to grow, and eventually it'll start to metastasize, and it'll start to break off and start to develop into or start to spread into different areas. Now, you can see stage 3, and then obviously stage 4, where it's metastasized and it's got a lot bigger and it's spreading. This is when oftentimes people start looking at, they've had the diagnosis, and they start looking for the farmer's market. They're trying to get whole foods. They're trying to eat all the right things. But oftentimes, this is too late. We want to try and get people to start taking that preventive action from now, while you haven't got any symptoms, or you have got symptoms, or they've not been diagnosed, but at least there's things that you can do that can prevent it from going from stage 1 to stage 3 or stage 4. We've had people that have had an early diagnosis. Well, they had like warning signs, but they had a check quite early. I think it was as early as February, and they said, "Oh, it's like stage 1." And by August, it had jumped to stage 4. So cancers are developing at a much more rapid rate than they were before, because of the state of the body and what's been happening. People have been they've been putting a lot of things into their body that they shouldn't have. They've had different sorts of organisms. They've had different inoculations that are having a very adverse effect on how the immune system is functioning. So lots of things are contributing to the speed at which these cancers are developing and progressing, and going from stage 1 to stage 3 to stage 4 very, very quickly. So we really want to empower people with the knowledge that they can actually interrupt this process by having the right information and putting the right interventions in place. And they'll be very surprised at how quickly your body responds once it's got the right environment, because your body's quite robust at responding to different threats, as long as it's got the right tools and access to the right resources. So looking at some treatments, available treatments for prostate cancer, you have obviously surgery, which is the one that they'll always opt for. If you can just cut it out, as far as they're concerned, it's going to eliminate the problem. And I know a few people that have opted for that, but it's left them obviously without the cancer, but then they've got that problem now of not being able to have erections, not being able to have good quality of life. Their manhood's been, a big part of their manhood's been taken away because they've removed the cancer. Yes, they still have life, and yes, those functions can be restored, but it can sometimes be a lengthy process to reconnect and get the the function of the reproductive organs working as they were before. Of course, they use chemotherapy, radiotherapy, hormone therapy as well, cryotherapy, and they've got the high intensity focused ultrasound, which is another quite effective remedy that they're using, or therapy. And then they've got quite a few different treatments that are available, but they don't make all of them widely known or widely available to people. But there are options, and the more you understand what's available, is the more you can actually request from your doctor or from your specialist or your urologist to look at these wider options. A lot of them are sometimes only available through private health or through private practices, but it's good for you to be aware of the different options, because there are quite a lot of different ways that you can actually deal with prostate cancer, as opposed to just only using the most common option, which is the chemo and the radiotherapy or the surgery. But are more interested in looking at how can we be preventive? How can we prevent ourselves from getting into this situation? You know, they say prevention is always better than cure. But it's good to know that there are ways that you can avert this situation from becoming the reality by obviously taking relevant steps. A lot of people at the moment are suffering in silence for the simple reason that they just don't know. They actually don't know that there are courses of action available to them, and they're just, you know, almost burying their head in the sand. I spoke to a few people even today. People are calling me like, "And man, I didn't know that this was available. I didn't know you could even have this sort of help." They're saying they're trying to get through to their GP. The GP is telling them, you know, that they can't get an appointment for 3 months or 6 months. They've gone to hospital fobbing them off. There's nothing we can do. They've given them, or they just palm them off with some medication or some tablets and say, look, let's take this. Or especially if they haven't got the full diagnosed or full developed cancer or full developed disease, there's no real interest in prevention. They're not really going to treat you, because if you're not somebody that can give you medication or palm you off with some tablets or a course of drugs, you're not really any use to them. So a lot of men are in this situation. I didn't realize it was so bad, and this is one of the reasons why I said I need to put on these type of talks to really empower you with the information and the knowledge that you may not have access to by any other means, so that you can then, you know, realize that there's some hope and actually take advantage of what's available and take steps to bring your health back under control and put it back into your hands where it belongs. So these are some of the preventive measures that we're going to speak about and show you about today. One is obviously the fact that you can have the non-invasive scan, that you haven't got to go through the whole invasive process. That's number one. You can actually do the scan that we do through your hand. That will show you clearly what state of your prostate is, if it's enlarged, if it's inflamed, if it's calcified. All these things, they contribute to, you know, your cancer risk and your cancer profile, and actually prevent it from developing into cancer once you catch it at the right stage. But also, more importantly, looking at what vitamins and minerals are really having an impact on the development of that situation. If you have a deficiency in zinc, a lot of people are, especially men are deficient in zinc, and zinc is important for so many functions. It really regulates the immune system, but it's very, very important for the production and the function of the testicles and the production of sperm. Because every time you ejaculate, your body dumps loads of zinc leaves the body. That's part of the reason why you feel so tired after you've ejaculated, because you've just lost so much zinc. So zinc is a very, very important factor in you developing, and it also helps with good erections as well. So if you have a deficiency in zinc, you're going to find you'll find it very hard to have good erections. I remember I had a client in Oman, in Dubai, and he was trying to conceive with his wife, an English couple, and he was a pilot. And I remember, I treated his wife for quite a few different conditions, and she was, was in a much better state of health. And he just, he wanted to really increase his erections, and he'd gone through the program. He'd done the dietary changes, lifestyle changes. And I remember when I did his scan, I found that his zinc was really low. So I remember him not really having a habit of making sure he was taking his vitamins and minerals. So he asked me, what can he do to increase the strength of his erections? I said, you know what? I'm going to send you a bottle of nano zinc. We use a lot of liquid minerals because we find it easier to absorb. And we sent him a liter bottle of nano zinc. And I said, mind you, when you wake up in the morning, you'll find that you won't need a towel. You won't need a hook for your towel. And he laughed. And, so said, so done. In about 3 weeks, after he received it, he told me, he said, you were right about not needing that hook for the towel, because every time he woke up with a really stiff hard on, and he felt really confident about his manliness. So zinc is really important for, sustaining and maintaining good reproductive health, and in particular, good erections. Zinc, also potassium. So most people that we find that have problems with their prostate, they always have a huge lack, a huge deficiency in zinc, and that's often chronic deficiency because the zinc is in a very low levels and it's been there for quite some time. So sometimes just topping up on their zinc will really put them in a much better position and help to provide the tools and resources that the prostate needs to regulate itself, and obviously to overcome the infection, because again, zinc is very good at boosting the immune system to fight off bacteria and infections. Also, your vitamins. Again, this is from a gentleman that we had just recently. He was very low in B1, and you can see B1's in yellow, the card on the right. His vitamin B1 was very low, and this is a person that was also diabetic. And we said earlier when we did the talks on diabetes that if you're experiencing tingling in your hands or tingling in your feet or numbness in your feet, that's a clear indication that you're very low in vitamin B1, which is thiamine. And thiamine helps to really metabolize carbs and helps to break down the carbohydrates when you have lots of rice, pasta, yam, potatoes, etc. If you're low in B1, those foods don't get broken down, so they tend to accumulate in the lower parts of your body because of gravity, and they tend to accumulate in your feet or your ankles, and people start to get swollen ankles or swollen feet. And when that process remains in that state for a continued period of time, it starts to stifle the flow of oxygen to those organs and to those tissues. So the first thing you notice is that area starts to go black because the oxygen levels are starting to go down or be depleted. And once the oxygen starts to die, you get a process called necrosis, where you get tissue death. Tissues start to die. As those tissues start to die, they then start going into that state of gangrene. And the next stage after that is amputation. Again, just because of not having a simple vitamin. So by them incorporating or increasing their B1, they would have been able to avert that situation and provide the relevant tools the body needs to be able to break down those carbs and stop that process from happening or degenerating to the level that it did, to the point of having to be amputated. So a lot of these things are preventable once you know exactly what you need to do and take the relevant action. As we said, knowledge is one part, but applying the knowledge is what's really going to get you from where you are to where you need to be. Also, you can look at vitamin C, we look at your vitamin K, we look at vitamin E. So we really get we take a deep dive into the state of your minerals and your vitamins. We also look at your amino acids. We look at your, what kind of plant extracts you have. Yes, it's good to have supplements, but it's always better to have it from a food source. So that way you can always incorporate the benefits of those nutrients from your diet. Prevention is always better than cure. So we're going to quickly look at some foods that you can incorporate to get some of these nutrients and get these vitamins, get these minerals from. You've got things like tomatoes. If you're a man and you're over 50, you want to make sure you have a good level of tomato ingestion in your diet, because tomatoes are rich in lycopene, and lycopene is very, very, very good for regulating the prostate and keeping levels of inflammation, especially when you're going to go into that type of hyperplastic state where you start to have the enlargement. If you have a good level of tomatoes or lycopene availability, that's going to have a very good impact. Also, things like pumpkin seeds. Pumpkin seeds are very rich in zinc, and they're very rich in potassium. They're very rich in magnesium. They're rich in all of the trace elements and minerals. Again, these are always needed to be ingest on a regular basis, because they really support your prostate health and help to bring things under control, especially when you've neglected to do so for any extended periods of time. Green tea is very, very good because of the catechins in green tea. Turmeric, again, another powerful anti-inflammatory. You've got your berries there as well. Broccoli, these cruciferous vegetables. Broccoli is amazing. Contains sulfur. Has a lot of compounds that really help and support the healthy development and healthy management of your prostate. Avocado, red watermelon, red grapefruits. There are so many foods that contain the nutrients and the compounds and the phenols and the fatty acids and amino acids that your body needs and can utilize, because it's in a natural state, and the body can recognize it and absorb it relatively easily. So there's so many things that are out there, but again, if you don't know, you just don't know. So this is why we want people to come on these lives, get the information and share it with other men that this could be the difference between them going to hospital or developing prostate cancer and not, just by having the information. So you having this information, you have a responsibility to share it as far and wide as you can with as many men and even women, because women will benefit from it too, because they're going to have fathers, they're going to have brothers, they're going to have sons who would need to know the things they can do to improve their health and prevent themselves from developing any of these type of degenerative conditions. So in conclusion for today, the three main diseases that we need to be aware of when it comes to our prostate is that the first thing we could try and prevent is from developing benign prostate hyperplasia, having BPH. Try and keep our prostate in the normal range for as long as we can, because it's very easy, it's very doable, as long as you take the right steps and you're intentional about making sure you maintain that level of health. This is how you can make sure you can prevent that situation from becoming your reality. Secondly, prostatitis, making sure we keep our levels of bacteria low by making sure we have the right levels of probiotics, we have the right levels of hydration. We keep our water levels quite high. Make sure because your body requires water for every single function. Every single function in the body relies on water, and the bladder is key. It's critical, especially in the winter now. People drink less water. It's highly likely that more bacteria going to start to build up and accumulate in the body. This is why people start to get colds more, because they're drinking less. So the more you're drinking is the more you're flushing. The more you're flushing is the more you're urinating. The more you're urinating is the more you're eliminating and removing these harmful toxins from the body and preventing them from accumulating, which will then start to lead to enlargement or inflammation. And of course, cancer, because cancer is going to be like the end result of these situations being left unperturbed for any extensive periods of time. So these are all the things that can happen to your prostate. But as long as you take the relevant action, because you now have the awareness, it will really help to reduce the chances of this becoming your reality and ultimately extending your life. Also, PSA is not very specific in prostate diseases because it's not going to be the sole determining factor. It's just one part of the picture. It's not, if people say your PSA is high, yeah, the PSA, people with high PSAs were 70 and 80 and live to, a ripe old age of sometimes 90 with high PSA. It doesn't necessarily, mean that because you have high PSA that you have cancer. So don't let that, because sometimes psychologically, just you hearing the words, "Oh, my PSA is high," you could, bring on cancer just through your thoughts. So it's really important that you maintain a good level of understanding, a good level of knowledge, so that you're not so easily deceived into taking action that you don't necessarily need to take. And of course, seeking attention, whether it's going to be medical or holistic or alternative, as early as possible, as early as you see the signs as possible. Don't wait until things start to develop. Take action now. Reach out to us. Reach out to your GP. Reach out to your whatever your practitioner you have access to. Reach out to them. Get in touch. Take action. Get yourself checked out. Get yourself tested. The sooner you know is the sooner you can start to turn things around. But the later you find out is the harder it's going to be to turn that juggernaut around once it starts to build up and gather momentum. So if you want to reach out to me, please feel free to look at the screen, use your phone and scan the code on the screen, because that gives you direct access to our Instagram, where we have lots of these type of videos. We share a lot of information on different topics. We're talking about diabetes this month because it's World Diabetes Month. We look at that, how you can bring your arthritis, back pains, joint pains under control using natural means. We have lots of foods and different foods that you can incorporate into your diet to alleviate a lot of different symptoms or conditions that you may be experiencing. So there's so many things that people can do once they have the information to really empower themselves and to take charge of their health, and not have to rely on a lifetime of medication or chemical-based drugs. So scan the QR code or scan the code on the screen now, so we can follow us. We can interact on Instagram. I'd love to hear from you. I'd love if you've got any question, you can always DM me. I'll always make sure I get back to you within 24 hours to make sure that if there are any issues, that we can address them relatively quickly, so that we can take the right action before anything takes you. Okay, so I'll give you a little bit of time to do that. But if you don't, you can always follow us on Instagram. You can just type in ask.juicedoctor. Let me type it on the screen. Ask.juicedoctor. That's ask.juicedoctor. Let me see if I can bring it up there. So if you want to follow us, everyone try and follow us on Instagram, so we can make sure we can interact with you on there. Let me go to that one, Instagram. Here we go. So you got ask.juicedoctor. You can use that to follow us on Instagram, and that we get notified where we upload any new videos or new talks. All these talks will be on there, or snippets from the talks will always be on there on our Instagram page. Likewise, we have our YouTube channel as well. If you can log on to YouTube is the same name, but it's just Ask Juice Doctor. Ask Juice Doctor DR. Let me get rid of the other one. YouTube.com, Ask Juice Doctor, where you get loads of testimonials of men, women, children who've had all different types of ailments, and they've come to us, and we've worked with them for sometimes 3 weeks, 3 months, and we've been able to have massive turnarounds because they've come in with all types of ailments: sarcoidosis, arthritis, rheumatoid arthritis, high blood pressure, diabetes, so different conditions. And we've just we have an award-winning 5-step well-being blueprint that we've employed in thousands of situations, and we've always managed to get them results. We never actually sell our services, because people always recommend us based on the results that they get. And this is why we find it so important to get this information out there, because so many people are suffering in silence because they just don't know what they can do and what is actually out there and available to them or for them. So we're trying to make sure as many people can access the information as we can. And if they want to take it further, we make sure we are available for them to do that. And lastly, you can go to our website, revolutionize.com, where if you want to get hold of any of the programs, any of the special offers that we have. And talking of that, I actually have a special offer for you guys today, because we've we come to the end of our talk, and we come to the end of the month. I said for those that have stayed with us to the end, it looks like most people have. I'm going to give a special offer to, let's see how we should do it to the first 10. The first 10 men, I'm going to give you an opportunity to have access to a, we have a very powerful reproductive, men's health and reproductive scan that we do, that really looks at the whole of reproductive health, looks at your prostate, looks at your testicles, looks at your hormones, looks at your testosterone levels, looks at your androgen levels. It looks at every part of reproductive health to identify any imbalances before they can develop into something, more sinister. So I want to give an opportunity for the first 10 men. How should I do this now? For the first 10 men to reach out to us. If you go on our website, you'll see on vivonutrients.com, you'll see that we have a men's health. If you type in prostate, body scan and prostate, you'll see we have a body MOT health scan that takes you all through that whole process. I'm going to give the first 10 men that scan. Let's do it for, it's £250 for that scan. Normally we do £500, £400 different scans that we do. £250 normally for that scan. I'm going to give you to the first 10 men for that body MOT scan. Give me a figure. Somebody give me a figure in the chat. What should I do it for? What's reasonable? The scan is normally £250. Give me a figure in the chat. Type in the chat, what should I do it for as a special offer for the first 10 men who are proactive, want to take charge of their health, take charge of reproductive health, and take action. Let's see who's ready to take action. Give me a figure in the chat as to what price I should do that for. 200, McLean. Okay. Thank you, McLean. Someone's giving me a figure. Okay, 100. Joy. Is that Jay? Okay, Jay says 100. Free! We're not speaking a language, Mike. Actually, so what we're going to do, you know what we're going to do? We're going to go right in the middle. We're going to give that scan away for £99 for the first 10 men that get in touch. Thank you. Yeah, 150. Free is good. People never really they never appreciate anything free, because when you don't pay attention, but when you pay attention. So we're going to cut it right down. We're going to give the first 10 men to reach out to us. We'll give it to them for £99. All you got to do is go onto the website. How can I do that now? £50. Be generous. I'm being very generous to now. I'm cutting. It's even less than half price. Thank you so much. £100. Yeah, that's what we're going to do. We'll do it at £100. In fact, we're doing less than £100. We'll do it for £99. How you access it is by logging onto our Instagram and leaving us a message on Instagram. Sign me up now. Okay, Michael's in. And if you want to do it now, actually, just put I'm in the chat. Type I'm in if you want to be the first 10, because I'm doing it open. I'm making it open to make sure people can access it either via Instagram, or you can access it via the chat, or you can go to the website. But if you go to the website, I want to make it nice and easy in a way that you can actually access it and actually get the appointment booked in. Okay, I can see some I'm in. So if you're in, just type in I'm in the chat. If you want to be one of the first, I'm going to write the names down. If you want to be one of the first 10 that will take up that special offer to get that body MOT scan. It's a full men's health reproductive scan. We look at all aspects of reproductive. We also look at your vitamins, your minerals. We look at your amino acids. We look at your testosterone levels. Look at your androgen levels. We look at your risk for developing diabetes. Look at your risk for developing cancer. Look at your risk for developing any kind of infertility issues. All of those things get highlighted and looked at. And we may even add in a digestive scan as well, where we look at the whole of the digestive system to get a clear picture as to what the state of your gut is. So we can look at if you have any gut problems or gut flora issues. Nathan's in as well. I'm just making a note of all those that are in. So keep them coming. If you're in, that's 2. So we've got 8 places. Oh, it's 3 gone. So we've got 7 places left. Oh, it's 4. Wow. So we've got 6 places left. If you want to take advantage of that, because actually we really want to make sure men are empowered, because men are, they're really, really suffering. and they don't come forward. You get a lot of women, all of our clients, 90% of our clients are women. And yes, they drag their husbands along, but oftentimes the men just sit at home, sit in silence, and they just get worse and worse and worse. The next thing you hear, they've dropped out, they've died. Oh, this person died of a heart attack. That person died of prostate cancer. And all these things could be prevented if they're taking a relevant action. So we're trying to make that available and accessible to you so that you don't become one of those statistics. So that's the end of our presentation today. I'm going to make a note of all those that have, Winston, you're in as well, making a note of all those that have said they're in. We're doing a scan for £99. I'll make sure you log on to our Instagram to send me a message on Instagram. Let me get the Instagram message, that Instagram title up there, and I'll take down a note of all the names. If I've got your numbers, I'll most definitely get in touch with you tonight or tomorrow. Failing that, get through to us on Instagram. Just go to ask.juicedoctor on Instagram. Just send me a DM, private message, and we'll make sure we book you an appointment anytime between now and January. You got time to book it in, but there's no pressure, there's no rush. But once you get that scan, you'll be blown away. You'll be completely blown away. You go to our YouTube channel, you'll see hundreds of testimonials. You see loads of people that have gone through the process, and it's really helped us to turn their life around. And even if you do nothing afterwards, at least you've got the information to be able to make the right decisions going forward. So if anybody's got any questions, feel free to ask now, because I'm going to end the broadcast because I want to really get this edited and down to an hour maximum. So when we share it, we're not going to hold people up for too long. But if anybody's got any questions, feel free to ask in the chat. I'm going to quickly look through the chat now as well. But thank you to all those that have joined. Thank you, Angelina, as well. Thank you, Robert. Great to see you. Oh, Mr. Hanson. Excellent. Nice to see you as well. Clifford, God bless you. Thank you so much, Donald. Kenrick, as usual. Tony. Wow, Tony was in the house as well. Good to see you, Tony. Washington, Colin Cameron. George as well. Wow, George. Wow. I'm really blessed today. McLean as well. Thank you so much for all you guys that come on. And I know we had a bit of an issue with the first link, but thank you so much for persevering and taking the time to join up on the second link once the message went out there. So yes, thank you. You're highly blessed. Yes, no, we are indeed. So God bless you all, guys. Thank you so much once again. If you want to look at the playback, I'll let you into a little secret. You can actually click on the link that you got today if you want to watch this again. Just click on the link for now. I think for about 3 days, you'll see the link. If you want to look on the playback, just click on the link that you got to join up today or to log in, and you'll be able to watch the playback and share it with your friends and family before we start to edit it. Alrighty, so thank you so much for joining us, and we'll do it again next week. We're going to have a different topic next week. We'll make sure we let you know via the text, but once you're in touch with us, whether via Instagram or you're on our WhatsApp page or you're on our YouTube, sign up on YouTube. If you go to YouTube, make sure you also subscribe. So that way, when next time we do it, we'll do it live on YouTube as well. So you haven't got to worry about the link. If you haven't got access to these type of technology, you can just log in through YouTube, and the YouTube link will give you direct access to the live. Alrighty, so that's me done. Thank you so much. I hope you found the information useful. I hope you found it beneficial. I hope you're more importantly going to take action with what you've learned today, and more importantly, that you're going to share it with others and empower other men that if they're still alive, then there is still hope. God bless you guys. Have a wonderful evening. Good night.
So you want great health, optimum vitality. With health being a global priority and inflation skyrocketing, time and money matter more than ever. So start working smarter, not harder. Introducing OxyFlush by My Healthcare Group. Natural health solutions that provide real results. You see, great health begins in the gut. In fact, the father of modern medicine, Hippocrates, said all disease begins in the gut. Over 70% of your immune system is also in the gut, so it's critically important to keep this area in optimal condition. OxyFlush helps quickly remove accumulated waste and associated toxins from clogging up the colon and preventing proper absorption of nutrients beneficial to your health. The impact is felt body-wide as immune cells are freed up to attend to other areas in need of attention. So, working smarter couldn't be easier. Clean your colon, lose weight and show off the healthier you. Powered by My Healthcare Group, makers of OxyFlush.
Michael, if you're still on the line, Mikhail Ben Levy, if you're still on the line, I haven't got your number. Could you make sure you log in on Instagram? Because I've got Winston's number, I've got Washington's number. I haven't got your number, Mikhail. Ben Levy, please make sure you get in touch so I can get your number. Jay as well. JS. I'm not sure if that's a J that's using the man up, but JS as well, please. You said you're in JS. Danelle. Danelle, you're a funny guy. Be generous. Okay, JS, Mike. Okay, I've got all the names down. I've got Max Penn as well. Nathan. Okay, Robert Answer. Yeah, I've got Robert. Robert, I think I've got your details. But make sure you get in touch with us anyway on Instagram. Robert Answer. I know I've got your number anyway. Donald. Wow. Tony Washington. Okay, I've got Washington's details. Thanks, Winston. God bless you. Thank you so much. Thanks, Colin. Thank you. Thanks a lot, Miss Anson. Thank you, Devon. Oh, Devon as well. Thank you so much. Shalom, Mikhail, Kenrick. Okay. All right, so we've got everybody in. Brilliant.